In today's class we are going to see most important topic in Unit 4, that is the tonometer. So the content of today's discussion is that first we will be discussing the empathy part, that is the patient perspective of this particular topic, why this tonometer is actually needed. Second one, we will define the problem statement, how this tonometer is going to address this problem which is being stated by patients and other stakeholders. And third one is the principle, the core working principle of how does this tonometer is working, and also followed by we will be looking to different types of tonometers and application, and finally we are winding up with the challenges and future directions of tonometer. So initially, if you are starting with collecting empathy from different patients and doctors, there is some condition called glaucoma. This is some kind of a disorder where the particular eye of patients having very high IOP, that is intraocular pressure. That condition is called the glaucoma. It will end up with even blindness or losing their sight. So this particular conditions makes the patients to feel losing their independence or losing their confidence to carry out their daily activities. So this arise the problems which require really one affordable and reliable device to detect the glaucoma at early stage, because the glaucoma is a condition, it will not come with early signs or symptoms. It is very difficult for even doctors or the patients to identify this particular disorder at the early stage. So that is the reason, if we have some sort of affordable device, then it will be easy for the doctors and the patients to detect this particular condition, to avoid the blindness, and also to boost their confidence level. So this is the empathy of having this particular tonometer. So the as a result, that is the solution to put the tonometer in as a picture. The tonometer is some sort of device which is used to measure intraocular pressure, that is IOP. So this because why the IOP measurement is very much needed, that actually what the tonometer is doing or measuring. The IOP is the something, it's a pressure which is being maintained inside our eye by two fluids, that is vitreous humor and aqueous humor. If the pressure is maintained at equal level, then we have a proper sight, proper vision. If it is not maintaining it, within that limit, then we will end up with high sotopping IOP that will leads to the major risk, which is called the glaucoma. So the early detecting with help of such device called tonometers, which really helps for the people, and also it improves the quality of life. So that is the empathy and defined part of this tonometer. So what are the different working principle which is behind in this measurement of IOP based on tonometer? In the sense, we have three methods. One is applanation method, second one is intention method, and third one is rebound method. If you take applanation method, here we are measuring based on the pressure or the force which we are giving to flatten the cornea. And second one is intention method. Here we are measuring the intention, that is the depth of intent which is placed under the known weight. And third one is rebound method. Here we are using the small lightweight probe. We are measuring the again the force which by means of how much rebounds is happening from the cornea, that we are calculating. So based on that, we will be measuring what is the IOP which is present in the eye. To make into simple, just we are measuring the force which is required to flatten the cornea. We could consider you have a balloon, it is maintain inside you have some pressure, so that it is a bulging. So and outside, if you are putting some sort of pressure, in the sense the outer surface of the balloon will get flattened. So how it's get flattened? Because of the balancing of pressure from inside and outside, so that it's getting flattened. So in this way we can indirectly we can measure what is the pressure which is inside of the balloon, because the same amount of pressure when you put outside as a counteract, then only you can have the flattening of that balloon at the surface. So this how we are using here. By putting the pressure, we are going to measure what is the IOP which is present in the hair by just by making flattening of the cornea. So this is the basic working principle of all sort of tonometers, whether it is applanation or intention or rebound method. Just we are going to calculate how much of pressure is we are putting in order to flatten the cornea. So second one, we will see that different types of tonometer. So first we have a gold applanation tonometer, that is a gold standard method for measuring IOP. Second one is non-contact. Here we are not making any contact with the cornea. I mean direct contact with cornea, just by passing the air or something we will measuring what is the flattening force which is required to flatten the cornea. And third one is rebound tonometer, which is again the protocol, which is identical for exclusively used for children. And then last one is intention tonometer. Here we measure the depth of intention on the cornea by placing the known weights. So by means of it we can easily find out what is the depth, that is the depression which is made by putting the weight, that is a known weight, we can easily measure. These are different types of tonometer. So next we will seeing the basic classification is that direct tonometer and indirect tonometer. As the name implies, we can easily identify it. So direct tonometer in the sense here we will be measuring the types of IOP by indirect way. That is, we are not making direct contact with your cornea. Just by means of air, pausing the air, we will be measuring what is pressure which is required to flatten the area. So in that case we have two types. One is intention tonometer, another one is applanation tonometer. So the intention tonometer, here we are measuring IOP by pressing into the cornea. The pressure which is required to create the intention, which gives you the output, that is internal ocular pressure. So example is that I have given here. The limitation is, we can see that it is by influenced by the thickness variance of your cornea. And the second one is applanation tonometer. Here we are using the principle called inbred fixed principle. So this is the principle. It follows the pressure inside the eye, which always equals to the force that is required to flatten the cornea. That is a certain area of the cornea. So again you have a two types. One is contact and non-contact. So again the contact in the sense we are making direct contact. In that case we are applying the needle directly inside your cornea, and then we will measure the pressure. Non-contact in the sense just you will pace over the surface at a light touch. So that is the non-contact type. So next we will see the application where this tonometer is highly recommended and where it can be used in the sense. First one is you can use it for screening and diagnosis the glaucoma, and second one you can use it for monitoring IOP during treatment, and third one you can use it for IOP regular checks. Even if you have surgery, after post surgery, if you want to check what is the IOP to have further discomfort or further monitoring or management, you can go with this type of tonometer. And last one you can use it for research aspect also, like if you are doing any research work in ocular biomechanics, then you can do use this tonometer for that case. But the challenges, whatever goods we have some limitation and constraints of using this tonometer. First one is this measurement accuracy is being influenced by the corneal thickness, because the people to people the corneal thickness will get vary. It may be influenced by so many factors like age factors and so many things. And second one, the patient may not feel comfort in some sort of types, like we have direct methods and contact methods. In that case we have to make direct contact with cornea, that in that case the patient may feel not comfort. And third one, it is sense in some advanced method where it's not affordable in cost wise, and the trained professional is very needed to operate this equipment. Non normal people will use this particular tonometers. Only trained people or professionals needed to use this tonometer. The future direction, we are in the world of AI. So obviously the AI enables this particular system even more good accuracy, with accuracy and protection, and we can have even painless tonometers in future, and we can even develop a low cost models and smart contact lens that is in align with the future. The assessment questions here I have posted related to this topic. Later you can view or check it out my video. And this is the activity we have played during the class hours to demonstrate how the cornea thickness is varying by using the balloon and the thick basketball. Okay, so how the pressure which is needed to flatten the balloon and ball, I mean basketball, how much the pressure variance you can see between the soft sub object and the hard object. This how the patient thick cornea and thin cornea will get varied. That we had a real time experience of using this activity using basketball and balloons. And overall the summary of this today class is that first we have discussed what is the empathy perspective of this topic, and then followed by we define the problem statement and the solution as a tonometer, and then we have a discussion of different types of tonometers, and then what is the basic principle which is behind this tonometer to measure the internal ocular pressure, that is the force which is required to flatten the surface of the cornea. That is the main principle for any types of cornea, I mean types you take in place of tonometer. And then we have discussed applications and future direction, and finally we wind up with simple assessment questions. Yes, thank you.